conditions
Right.
for success, but we haven't been back to talk to the FDA yet. We just So islets are clusters of cells that reside in the pancreas, and their function is to secrete hormones that control blood sugar. So essentially, if you, with a person with a normally functioning pancreas, maintains their blood sugar within a very narrow range, no matter what you eat. What we're dealing with in this study is people who have type 1 diabetes. In type 1 diabetes, the patient has an autoimmune disorder in which their own immune system destroys the islet cells in the pancreas so that they no longer make any insulin. Normally, a person with diabetes or a person who doesn't have diabetes gets symptoms when their blood sugar is low. So you may get tremulous, start to shake, or you start to sweat, or you get very irritable, and you know you have to eat something. But for a subset of people with type 1 diabetes, they lose that awareness. So they have what's called hypoglycemia unawareness or impaired awareness of hypoglycemia. And those people can get into serious trouble because their blood sugar will continue to drop until it's so low that they're incapacitated and they can no longer help themselves. They can't walk to the refrigerator and get some orange juice or do something else to help themselves. They may have seizures, they may just become unconscious, and people can die from this. So I think what we've demonstrated with this study is, number one, islet transplantation can eradicate severe hypoglycemic events while providing better control of blood sugar than any other therapy that's been tried in this particular population of patients, and that multiple sites can follow the same procedures, a very complicated manufacturing procedure, to produce comparable islets, which can be characterized completely enough that they should meet the bar for approval by a regulatory agency, that is, by the FDA. And we submitted the clinical report to the FDA. The FDA